Hey guys, it's Shayna. Today I want to talk to you about our Pico Laser, which we have right behind this door with Dr. Downs and Kim. What the Pico does is it helps with fine lines and wrinkles and its skin rejuvenation for your face, as well as texture, evens out pores, tones. So today we're going to show you how that procedure is done, and Kim is one of our master estheticians and our laser tech that does a lot of these procedures with Dr. Downs. So if you have any questions for any of them, comment them below, and we will be happy to answer any of them. So we hope you guys enjoy. Here we go. All right, guys, I'm here with Kim and our patient, Andrea. And Kim, talk to me about what you're going to do today.
Okay, so today we're going to do Pico Skin Rejuvenation. This laser is one of the newest on the market. Pico technology, or picosecond technology, just means that it fires very quickly at a picosecond. Most of this technology prior had fired at what was called a nanosecond. But because of the quickness of fire, we're able to build heat deep into the skin, into the dermal area. That's where your collagen and elastin lie. That's where your pigment cells start. And that's where much of the origination of the skin cell begin and then end up migrating to the surface. So it's able to heat that dermal layer of skin to help contract collagen, but it also helps with pores, the texture of the skin overall, the tone, as well as these hyperpigmentation spots, which is part of the tone, okay? So what's to be expected is, redness post-treatment, as well as some darkening of some of the pigmented lesions or pigmented spots on the skin, whether it be sun damage, freckles from the sun, even some melasma, which is a hormonal disorder of pigment. It can help with those things. But what's nice about this laser is that it not only does this wonderful skin rejuvenation treatment, it also removes tattoos. Tattoo removal has been a very sought after treatment for people, especially as of late. Before, tattoo removal would take so many sessions to rid of a tattoo. We could look at 10, 12, 15 sessions to be able to rid of some of the most stubborn tattoos, depending on color, size, and where they are in proximity to the heart. So what the Pico has done is cut that time in half. So a lot of times we can remove tattoos in about 6 sessions, again, depending on color and size and proximity to the heart.
All right, I'm ready to get started.
We're ready to get started. So this is Andrea. She's our patient.
Say hi, Andrea.
Hi. Overall, her skin, she's got some little hyperpigmented areas, like up here on the forehead, in some little spots. She's got a little bit of diffuse redness as well, like on the chin, a little bit on the nose. But her texture overall is good. We want to see a little refining maybe around her mouth and by her eye area here, and even a little bit on the forehead. So what she will experience is some darkening of these pigmented spots over the course of the next few days, as well as some immediate tightness, okay, of the skin. So she'll be feeling that right after. All right, so she's been cleansed and prepped. She's got her goggles on, and this is pretty much how you would come in. We would wash your skin. It's okay if you have makeup coming in. Don't feel like you have to wash that off before you come. I will do that for you, okay?
And I have my goggles on too. You just can't see them.
Yes. So the laser just takes a minute to warm up, and I'm going to actually start right here in the middle of her forehead, okay? And you ready, Andrea? I'm going to start.
Yep.
Okay? So what I'm going to do is I'm going to work in small areas here and do several passes until my end point is visible, and that end point is typically just redness. So what's nice about this laser is that there's really no downtime per se. It's not like you're going to be extremely swollen. You're not going to have any, oozing or bleeding or anything like that. You're just going to have some redness and then darkening of some of that pigment possibly. So That redness, you can put makeup on right after over it. You can go back to work. A lot of people do this over lunch because it only takes about 15, 20 minutes at the most, and is just a great treatment if you're kind of in a hurry and you don't want to take a lot of time out during your day to have a procedure done.
Now, how much does this procedure cost?
Typically, we recommend about 6 treatments. In those 6 treatments, we often include our Obagi Nuderm kit. That Obagi Nuderm kit is a kit that helps address multiple skin issues, including hyperpigmentation, texture, even acne breakouts and things like that. And that kit is very comprehensive and accompanies the laser results beautifully. So when you're using that, you really get a great outcome because they work kind of synergistically. So with the 6 treatments and the Obagi kit that includes Retin-A, that runs about $2,600.
Okay. And how are you feeling, Andrea?
Fine.
Good. Kim, now explain to the viewers what this laser feels like on their skin.
It kind of feels like a little sparkler almost on the skin. Kind of a little electricity type of feeling, and of course warmth. But there's no residual discomfort whatsoever. It's just kind of like a sunburn feeling right after. No pain, you know, no tingling even, just that kind of warmth.
Okay. And you said this laser also is used for tattoo removal?
Correct.
So is this the same concept? Is this how it works when we do the tattoo removal?
No, tattoo removal is a little bit different. What I do is it's based on the spot size. So right now I'm using a little larger spot size for the face because I'm trying to build heat. I'm trying to bulk heat. And with tattoo removal, I adjust the spot size according to the size of the tattoo and the color, etc., the skin type. And that, you can hear kind of a more snap of the ink because for the PicoSure, when I'm doing tattoo removal, the PicoSure is targeting the ink specifically, okay? So you're going to hear it target that ink. So you're going to hear a snapping, but you're also going to see a whitening, which is called frosting.
Mm-hmm.
And so it's going to be a very different type of sensation as well. It is going to be, you know, more uncomfortable in the sense because you're targeting a concentrated area of pigment.
Now, can this only be used on the face?
No, we use it on the neck. We can use it on the décolleté, the arms even. Legs, lower legs is great. So if you've got a lot of sun damage, as long as you don't have a fresh tan on the skin, we ask that the tan be 4 to 6 weeks old, then you can undergo this procedure. And in fact, coming off of summer and going into fall and winter, that is a great time to start your treatment for hyperpigmentation on these certain areas of the body that might have been affected by a lot of sun damage this summer. Typically we do the 6 treatments and they're spaced about 4 weeks apart. So once a month you come in, you have your treatment, and then you come back again in a month using your products in between.
So do you use your products in between?
Absolutely, morning and evening.
Mm-hmm. And what is in that kit? The cleanser, toner?
You've got clear, which is a hydroquinone that affects more of that visual pigment on the surface, the more visible type pigment. You also have Exviderm Forte, which is a combination of alpha hydroxy acids that help lift the dead skin during the day. Then you've got Hydrate that you use during the day and sunscreen. And then at night, you've got another portion of hydroquinone mixed with Retin-A that you use to help combat some of that deeper pigment.
Mm-hmm. And, you know, one thing you were talking about explaining earlier was hyperpigmentation. Can you explain a little bit more about that? Because I'm not quite sure what that is.
Hyperpigmentation is typically caused by sun. About 80% of our aging and damage comes from the sun. A lot of people think it's genetic, but it actually is UVA and UVB damage, okay? So what happens when we tan, it's actually our body's pigment cells responding to try to protect our skin because it senses radiation, and radiation obviously is not good for our skin. So our tan is our first line of defense. Well, what can happen is those cells that are pigmented cells can become abnormal and darken. Those darkened pigment cells then will form spots on the skin or areas of dark. And those dark spots, a lot of times they remember that they're dark. So when people go out in the sun, they get darker. Well, yes, because those pigmented cells are absorbing that radiation. Well, then typically in the wintertime, some of them may fade, but some of them may also stay. And those are more permanent, pigmented lesions or hyperpigmentation. So what we have to do for pigment is that a lot of times it just doesn't go away on its own. So we have to use product and pretty consistently, and then combined with the laser treatment will help suppress some of that pigment from coming to the surface, while the laser will address also that surface pigment and bring it up and kind of have it flake off and get darker, and it goes away. But sometimes the pigment can come back, and that's very common. And we see that also with melasma, which is a hormone disorder, because hormonal fluctuations in the body will trigger that pigment. So hyperpigmentation is difficult to combat, and it's something that requires maintenance. Just like your hair, you cut your hair every 6 weeks or 8 weeks or whatever, and you color it. You've got to do the same thing with your face. It's not one and done. It's not do a series of 6 and you never have to do anything again. It's all about maintaining your results.
Now, what type of skin types can be used with this procedure?
We can do all skin types with this procedure. Typically, though, we see your, lighter to medium skin types. 1s, 2s, 3s. Andrea's a 3. She's kind of in the middle. She's a little bit more prone to having a brown tone to her skin, although she does have some redness. But yes, we can use this on most skin types safely. Now, dark skin, we don't typically do a lot of skin rejuvenation on, because we don't see those same issues like hyperpigmentation. We do have alternatives for those as well.
Now, does this help with like broken capillaries?
You can get some resolve in like a diffuse redness overall, but we have another laser that addresses the little broken capillaries around the nose and on the cheeks and the chin, and that would be our YAG laser.
Okay.
You doing okay, Andrea?
Yes.
Good.
Now, we forgot about to ask how our patient's doing.
Okay. I'm good.
Now, for the viewers, how much does this cost, Kim?
This is $2,600 for 6 treatments, including our full-size Obagi Nuderm system.
Okay.
So as you can see, she's got a nice endpoint of redness, and sometimes I even go in with adjusting the laser just a touch. So let me adjust this, and I'll kind of show you what it would look like to address some of the areas of hyperpigmentation that may have emerged. So she's got a few spots like on her forehead. I know it's probably hard to see because she's kind of pink, but those brown spots done, I can go in like right here, use a little smaller spot size, and I'll show you what that looks like. And this is kind of similar to what it looks like out when you do a tattoo, okay? So Andrea, you're going to feel a little bit different sensation, but it's not going to be constant, okay?
Okay.
You ready?
Yep.
So I'm going to hit this just real quick. Ready?
Yep.
Is that okay?
Yep.
Good. See, so it has a little whiteness to it. I don't know if you can see that. This one too. You can hear the snap. And that kind of frosts. And then what happens is those hyperpigmented spots, some of the lentiginous, which are freckles, kind of get dark, flake off, and then they're gone. Is that okay?
I agree with everything she just said. No, this is a great laser. It's just fantastic in terms of getting rid of those types of things. It's state of the art. How's it going? How's it feel?
It feels fine.
You did great.
Little
Yeah.
sparklers is what it feels like.
Is that what it feels like? Little sparks on it. Sure.
People have noticed a lot of tightening with this laser tool. I even had a lady, she got a lot of tightening in her forehead, and she just felt kind of instantaneous, little bit of a lifting even, which when you're stimulating collagen over the course of 6 treatments, every 4 weeks, you're getting that collagen contraction in the skin. So you will feel tightening as well.
Did you talk a little bit about downtime?
Yeah, absolutely.
Okay, good. Because
Really
there's very little
great.
downtime.
Yeah, just
with
spread.
this is fantastic for that. It looks like a little. She'll look a little windburned for a while. Feel a little tingly. We'll have her use a good moisturizer post-operatively. Then we have a whole series of pre and post laser treatments that she'll be using just to take care of the skin as it goes. So that's good. Yeah, you look nice. You look. You've been out at a Notre Dame game for about
Or in
for an afternoon.
back from Cancun.
You feel
So
good?
I just put a little
That's good.
sunscreen on before you leave, and like I said, you can put makeup on right after. That's fine. And then you would just continue with your regimen as instructed.
All right. So, Dr. Downs, do you have any last words on our PicoSure laser?
Well, it'll be interesting to see. One of the things that'll be fun to do is just take a look at where she is, after the redness goes down, and after that, in a couple weeks, just to come back and take a look at results. That would be fun. That would be good to look at. Yeah.
Okay. So, again, you can see Dr. Downs next Friday on the 23rd.
That's right.
We'll announce on Wednesday what we'll be doing, Facebook Live. And if you have any questions, please comment below, and we'll get them answered as much as you can.
Yeah, send us your requests. I mean, if we do most every kind of laser and injectable you can imagine, so that's fantastic. But if you have anybody out there has a specific interest in terms of what they want to see, it'd be interesting for us to know, and then we can demonstrate that live on Facebook for you.
All right. Well, if you have any questions, give us a call, 574-968-9100.
Good. Have a great weekend. Go Irish.
Go Irish.